Come in. Again, my name is Rhea. I'm the Director of Health and Fitness at the Reh-Fit Center, and we're so happy to have all of you here for our Fit Talk tonight. If you missed it, we're talking with Dr. Christine Friedenreich. I keep saying it wrong, I'm sorry. Physical activity, sedentary behavior across the cancer continuum, and we're going to talk about the current evidence and guidelines. So we're very fortunate to have, I think, one of the prominent leaders in this area. So thank you again. If you have questions or comments, we're going to try and save them for the end, and you can use the chat box on the bottom of your screen of the Zoom call. If you're participating through our Facebook Live, you can type a question in there and we'll get back to you later today or for sure tomorrow as we kind of review them there. So without further ado, I will pass it over to you. I myself will mute myself, and I will see you when you're near the end. So good luck.
Thank you very much. So first of all, thanks very much for this opportunity to present some of the work that I've been doing in my career for the last 30 years or so. As discussed, we're going to be talking about physical activity, sedentary behavior across the cancer continuum. Hopefully my slides will advance. Oh yeah, there we go. So today I'm going to be talking, first of all, giving you a bit of an overview on the number of cancers in Canada that could be prevented by lifestyle changes. Then I'll specifically be discussing how physical activity and sedentary behavior are associated with cancer. And then I'll end the presentation talking about some of the current physical activity guidelines for cancer prevention and survival. So to begin with, I'll start off with some definitions here. So the first, on my slide, this is getting a little bit cut off, but hopefully you'll be able to see the top. We have the definitions of what is physical activity and what is sedentary behavior. So essentially, physical activity is any kind of muscular movement that involves energy expenditure, and this can be in leisure time, like exercise and sports activity. It could be something that's done at home, any kind of household chores, lawn, do-it-yourself type of activities, and garden activities, or anything that you do through your work, occupation, or school. And then also physical activity can be done in transportation as in active transportation to work. This is in contrast to sedentary behavior. And sedentary behavior is a concept that's more recently been identified that's distinct from physical activity. And essentially that is any kind of activity that's characterized by a very low level of energy expenditure, and that's done while sitting, reclining, or lying. Now I've also included here a very nice infographic that's just been produced by the World Health Organization. They have just developed some physical activity guidelines that also included guidelines on sedentary behavior that were released just this last November in 2020. And their motto is every move counts. So you can see in this infographic, they're showing how they're essentially recommending that people move from being sedentary, as in sitting, to trying to be more active and trying to get 150 to 300 minutes per week of physical activity. So we'll be coming back to these physical activity guidelines at the end of this presentation. I'm going to start by talking to you about a study that I led called the COMPARE study, which was a Canadian study that we did in partnership with the Canadian Cancer Society. And we were looking at what number of cancers in Canada could be attributed to being exposed to certain lifestyle and environmental factors. And this is a slide that shows a video shot from the Canadian Cancer Society's website that was the result and the culmination of the research that we did, where we found that 4 in 10 cancer cases could be prevented. So now I'm going to go specifically to show you some of the results from that study. Here we have the main infographic from this study that showed how many cancers in Canada could have been prevented if we didn't have exposures to some of the main risk factors for cancer. In the middle of this infographic, you see that tobacco accounts for nearly 33,000 cancer cases. But what's interesting is that physical inactivity also could be responsible for nearly 12,000 cancer cases in Canada, and excess weight, 7,200. And as you go around this infographic, you can see that the size of the circles decreases, and that's in relationship with how important those risk factors are. So you can also see at the top of the slide that sedentary behavior is also associated with over 3,000 cancer cases. And these were estimates that we did for the year 2015. We then also looked at the question of, by different cancer sites, what were the major causes of cancer for each one of the cancer sites. And what I want to focus in on here is that 10.6% of all associated cancers can be attributable to physical inactivity, and 10.3% can be attributed to sedentary behavior. So you can see here, for example, for lung cancer, where we can account for nearly 88% of those cancers, a very large percentage is attributed to tobacco smoking. So that's what's in red, that goes across all of these cancer sites. And then you can see that there are other risk factors such as dietary intake, air pollution, some of the infectious agents that are also important. We also looked at how the changes in the number of cancers that could be attributed to these different risk factors could occur if we actually were able to change the exposures. So if we could get people to be more physically active, how would the number of cancer cases change over time? And we did this modeling over a 30-year time period until 2042. And see, on the left-hand side, you can see the annual preventable number of cases that would occur if you had a 10, 25, or 50% reduction in physical inactivity. And on the right-hand side was the cumulative number of cases. So if we were able to increase the level of physical activity in the population by 2042 to having a 50% reduction in physical inactivity, we could have close to 40,000 cancer cases that would not occur. This is a summary infographic that we prepared with the Canadian Cancer Society that sort of summarizes all the information for physical inactivity with the motto, move more to reduce your cancer risk. So it shows here that 7 out of 10 Canadian adults are not active enough. We also show that 11,600 new cancer cases were due to physical inactivity, and that if this trend continues, the number of new cancer cases due to physical inactivity will increase from 11,600 to 16,500 in 2042. So together we could prevent about 26,200 cancer cases by 2042 if more Canadians were active. So these are actually pretty powerful numbers, and a lot of these data have now been used by different cancer organizations across Canada to help convince people about the value of thinking about cancer prevention. So now I'm going to focus to thinking about how physical activity is related to cancer across the entire continuum from prevention to survivorship. This is a framework, a theoretical framework that I developed with my colleague Carrie Curnier at the University of Alberta early on in our careers, when we had much darker hair than we do now, on how we could organize our research thinking about physical activity. When we started doing research in this area in the early 1990s, there had been very little research done on how physical activity was related to the risk of developing cancer, and then when somebody was diagnosed with cancer, how we could use exercise to help them deal with their treatments, to help improve their rehabilitation and coping with the treatments, and then also how exercise could be used to help improve their survival after cancer. So now we have actually done systematically a number of studies across this entire continuum, and I'm going to be explaining some of the research that we have found over this 30-year period. We'll start first by looking at how physical activity is related to cancer prevention. So here I am showing all of the research that has been done on how physical activity, and however it's measured in a number of different studies, how it's related to the major cancer sites. And for simplicity, if you look at the right-hand column of this table, you can see that for 6 of the major cancer sites, we actually have very strong evidence now that being physically active helps reduce the risk of developing bladder cancer, breast cancer, colon cancer, endometrial cancer, esophageal cancer, and kidney cancer. And you can see the number of studies that have been done on each one of those cancer sites. And you can see that the majority of research has been done on breast and colon cancers. And that we can see that for those cancers, as well as for endometrial cancer and esophageal cancer, we're seeing very strong risk reductions. In other words, when we compare the people who are most physically active to the least active in those studies, we're seeing about a 25 to 35% risk reduction. We also look at the question of dose response. So in other words, if someone does more physical activity, does that reduce their risk of developing those cancers even more linearly? I mean, you can see that for many of these cancer sites, we actually have some very good evidence that being more physically active does actually reduce your risk of developing those cancers even more. For some of the cancers that are lower down on this table, we don't have quite as strong evidence yet. For example, for lung cancer, the evidence is classified as moderate, because we also know that for lung cancer, there's very strong confounding by smoking. And then for some of the other cancers, like for ovarian, pancreatic, prostate, and stomach cancer, the evidence is more limited, or it's moderate to strong evidence. And that for some of these cancers, like pancreatic cancer, which is a rarer cancer, we just haven't had as many studies that have been done to look at those associations. But that evidence is definitely accumulating. Now I'm going to move across that continuum and talk to you about exercise interventions that are done during and after treatment. And I will just preface this section by saying, when I started doing research in this area with my colleague Carrie Kernier, the general advice that oncologists were giving their cancer patients was, you should rest, you're going to be fatigued because of your cancer treatment, you shouldn't overexert yourself. And there was even quite a bit, I would say, animosity towards considering putting anybody onto an exercise program during their cancer treatment. We were able, however, to show that you can definitely do exercise during cancer treatments and beyond. So here is the current state of evidence for how we can do, what the benefits, I should say, are of doing exercise during and after cancer diagnosis. We now have very strong evidence from many studies that have been done that following the FIT principles of exercise, which looks at the question of exactly what kind of dose and intensity and type and timing of activity, for improving a number of different patient-related outcomes that are associated with cancer. So we know that those people who are physically active have better health-related quality of life, they have better physical function, they have reduced lymphedema, particularly amongst breast cancer patients and survivors. They have reduced fatigue levels, reduced levels of anxiety and depression. There's also moderate evidence that there's improvement in bone health and in sleep. And currently, the evidence is insufficient for how exercise influences cardiotoxicity, because we know that a lot of cancer treatments are quite cardiotoxic, and also how exercise influences chemotherapy-induced peripheral neuropathy, which is a problem for certain kinds of cancer sites, and how it affects cognitive function, falls, nausea, pain, sexual function, and treatment tolerance. These are definitely areas that are hypothesized to be associated with improvements with exercise, and there's definitely emerging evidence, but it just wasn't as strong or as well established as some of the other outcomes that I've already mentioned. So now I'm going to talk to you about physical activity and cancer survival. So we conducted a systematic review and meta-analysis of all the studies that have been conducted that have looked at some aspect of physical activity either done before diagnosis or after diagnosis. And we looked at how that was related to dying of a specific cancer site, looking at cancer-specific mortality, and we also looked at it for all-cause mortality. And so what you can see here is the results in two columns for pre- and post-diagnosis physical activity associated with cancer-specific mortality and also for all-cause mortality. And so what's very encouraging is that there's now some very strong evidence that being physically active before diagnosis can actually improve your survival after diagnosis. And also there's even stronger evidence that if you take up physical activity or maintain your levels of physical activity after cancer diagnosis, that you have improved survival. And when you combine all of this, there are 11 cancer sites for which we now have pretty strong evidence and very consistent evidence that there's improved outcomes after cancer. So this is actually very exciting because this is something that's available for everyone to do. Now, I'm also going to focus on sedentary behavior and cancer. As I said before, sedentary behavior is any kind of activity that's done sitting, lying, or reclining. First of all, we'll look at how sedentary behavior is related to cancer incidence. So this is the risk of developing cancer. So as you can see, there aren't as many studies that have been done on sedentary behavior since the focus on sedentary behavior is actually fairly recent, maybe in the last 10 years or so. Whereas the focus on physical activity dates back to the early 1990s, and even some studies were done in the mid-1980s. So there haven't been as many studies done, and you can see that the evidence is not quite as strong as it is for physical activity or physical inactivity. So as you can see, there is for ovarian cancer quite a strong increase in risk of ovarian cancer for being sedentary, and that there's moderate evidence for colorectal cancer and endometrial cancer as well. For breast cancer, it's not as strong. There's weak evidence of an association and limited for esophageal and prostate cancer. And now we'll just look at the results for cancer-specific mortality. So this is the association of sedentary behavior and the risk of dying specifically of the cancer that you were diagnosed with. So here we can see quite strong evidence that sedentary behavior does increase the risk of mortality associated with colorectal cancer, and also moderate evidence for when we just look at studies that combine all cancer sites. For the other cancers, the evidence is still more limited, and it appears for prostate cancer that there's actually limited evidence for a decrease in risk associated with prostate cancer, which is a little bit different from what we see for all the other cancers. And then when we look at all-cause mortality, so this would include any cause of death, including cardiovascular disease, which we know is a very strong cause of mortality amongst cancer survivors. We can see that the evidence is somewhat stronger, particularly for colorectal cancer and all cancers combined. For female reproductive cancers, this would be like ovarian, endometrial, and cervical cancers. There doesn't seem to be much of an association. And again, for prostate cancer, we're seeing this slight risk reduction, but it's not statistically significant. So now I'm just going to give you a bit of a summary on what we found on physical activity, sedentary behavior, and cancer mortality. First of all, I showed you that there is improved survival for at least 11 different cancer sites associated with higher levels of physical activity. We also have sufficient evidence that for breast, colorectal, and prostate cancers, that this evidence is quite strong, but it's more limited for most of the other cancer sites. We showed that both physical activity done before and after diagnosis is associated with improved mortality outcomes. We found that I didn't actually specifically show you the level of the risk reduction, but I can tell you it's about a 20 to 40% reduction in risk of mortality associated particularly with post-diagnosis physical activity. So this is actually a very good news story, because often people are motivated to take up some healthier lifestyles after a cancer diagnosis. And so it's quite an empowering thing to be able to say to them that, yes, if you want to become more physically active after your cancer diagnosis, it can actually help improve your survival after cancer. We looked at the question of dose response. I didn't specifically show those slides to you here, but we do see that there is a nonlinear dose response. So in other words, as you do more physical activity, the risk of dying of your cancer goes down in a linear fashion, and then it kind of flattens out at higher levels. So we see some fairly strong risk reductions with even lower levels of physical activity. And the evidence, as we saw, was still somewhat preliminary for sedentary behavior and mortality. So now we'll move on to the current physical activity guidelines for cancer. There are a number of different organizations worldwide that have been coming out with guidelines on physical activity and cancer prevention and survival. The first group that came out with guidelines in 2018 was the World Cancer Research Fund, which is based in the UK, and they have a sister organization called the American Institute of Cancer Research. And they developed this very nice infographic on their cancer prevention recommendations. You can see the first recommendation is to be a healthy weight, and the second one is to be physically active. And the goal here is to be at least moderately physically active and follow or exceed national guidelines for the World Health Organization, and to also limit sedentary behaviors. What they also included in this infographic was a number of other recommendations regarding dietary intake. And also they have at the very last bubble that you can see on the right-hand side. At that point, they just said, after a cancer diagnosis, follow our recommendations if you can for cancer prevention. So here at this time, there wasn't anything very specifically developed from a cancer survival perspective. In 2018, the US Department of Health and Human Services came out with the Physical Activity Guidelines for Americans. This was the second edition that followed the 2008 first edition. I was involved in helping develop these guidelines, and the first overarching guideline was that adults should move more and sit less throughout the day. So this is the combination of thinking about being more physically active and less sedentary. When they got more specific about looking at different types of activity, they said for aerobic activity, so this is what some people would call sort of cardio type of activity, for any aerobic activity to have substantial health benefits, the recommendation was to do at least 2.5 to 5 hours per week of moderate activity, or 1.25 to 2.5 hours per week of vigorous activity. So moderate activity is something that, raises your heart rate a bit, but doesn't cause you to, full out sweat or anything, whereas vigorous activity would be much more intense activity. Or you can do the equivalent of both. The recommendation further said that you should preferably spread this throughout the week. You can get additional benefits gained by doing more moderate to vigorous physical activity. They also had a recommendation on muscle strengthening activity, which is also called resistance exercise. And the recommendation there was to try to do this 2 or more days per week and to use all major muscle groups at a moderate or greater intensity for additional health benefits. Following these guidelines, the World Health Organization came out specifically this last year in November with guidelines for cancer. And they followed very closely what the physical activity guidelines for Americans had done. And for the first time, these guidelines came out also looking at physical activity and sedentary behavior. So here you can see the different infographics that they produced, and these ones are specifically for individuals with chronic conditions. And they did include people who were cancer survivors, who had diabetes, cardiovascular disease, and hypertension. So these guidelines were felt to be appropriate as well as for healthy populations to reduce their risk of developing these chronic conditions. So the recommendations here are very similar to those from the US, with 150 to 300 minutes per week of moderate intensity aerobic physical activity, or 75 to 150 minutes per week of vigorous intensity activity. And then the muscle strengthening was again 2 days per week. And then the concept that if you can do more than that, that you would have additional health benefits for more than 300 minutes per week of moderate intensity activity, or more than 150 minutes per week of vigorous intensity. And they also were suggesting multi-component physical activity that emphasizes functional balance and strength training at moderate or great intensity. So that's where you can see in this infographic that they're suggesting activities like Tai Chi or whatever that focus on balance and functional strength. So the question is, how can these physical activity guidelines be met? So another way of looking at the guidelines is thinking about how many metabolic equivalents are expended per week. And a MET is one MET is essentially the amount of energy that's expended at rest when someone's not doing any activity. And so here you can see if you were trying to reach these physical activity guidelines of 15 MET hours per week, you could do running at 2 days at 30 minutes, which would equal 60 minutes times 8 METs, which is 480 METs, or 8 MET hours. And likewise, if you were doing brisk walking, that would be something like 14 sessions, 2 sessions per day at 15 minutes, which equals 210 minutes times 6 METs, which is what brisk walking would be. That would give you 21 MET hours, and so on. So the idea here being that there are lots and lots of different ways that people can reach these physical activity guidelines, because all kinds of activities can be considered, including housework, gardening, resistance exercise, activities of daily living like doing active transportation, walking upstairs, and so on. So in conclusion, what have we shown here? We've noticed that physical activity reduces the risk of developing cancer. It can improve rehabilitation and survival after cancer. We've also shown that sedentary behavior is an independent risk factor for both the risk of developing cancer and the risk of dying with a cancer or all-cause mortality after cancer. We know that physical activity is a very cost-effective means of controlling cancer across the continuum, and it's something that's accessible to practically everyone, because even doing walking is a very effective way of reducing your risk of developing cancer and also improving rehabilitation and survival after cancer. And as I've shown you just recently, we have physical activity guidelines for both cancer prevention and survival that have been developed by a number of agencies around the world. So I thank you very much for your attention, and I'd be very happy to answer any of your questions.
Thanks, Christine. That was great. Lots of really good, I loved all the infographics. Just puts things into perspective when you kind of see it in those ways. They always do such a great job of sharing that. So if anybody has any questions or comments, again, just you can use the chat box on the bottom. And if you are just absorbing all of the really good information that we got, I completely understand, because I also was jotting down notes trying to think of maybe there is a question, but you kind of just kept answering it as the slides went along. So I'll honestly say I don't really have a huge burning question. You've covered so much of it. So if anybody else has anything, or they just want to think about it again, you can always kind of put it in the chat box here, or if you want to enter something in on Facebook Live, we can do that as well. Someone's asking if the presentation is available. So it will be uploaded and it'll be on our website tomorrow. Someone's asking, I know the bad results of sedentary behavior, but why is it? I'm not sure. I think what they're maybe referring to is, maybe Stan, if you can elaborate on your question a bit. I don't want to read into it and ask the wrong question, but are you asking about sedentary behavior and why there's so many challenges with it, or what is sedentary behavior? Someone asked, and that's a good question, I had the same thought, how is physical inactivity different from sedentary behavior?
So, okay, so I can certainly answer that question. I've just stopped sharing my screen, so I think that's probably okay. And yeah. I can see everyone now, so that's nice. Yeah. So essentially, like, if you think about it, any activity that you do while you're sitting, while you're lying down, or you're reclining in a chair or something like that, that would be considered sedentary behavior. As soon as you start standing up, moving around, walking about, then you're doing physical activity. So And if you're at the lower end of that physical activity spectrum, let's say you just walk around the house a little bit, then you would be considered like physically inactive. If you are doing something that's more of a, an actual planned program, that would be considered like, exercise, because that exercise is a component of physical activity. We also call that recreational physical activity. So that's kind of how we distinguish those two. I hope that's answered it. And the question from Stan,
yeah,
so I think that maybe, are you talking about sort of what are the underlying biological mechanisms? Like, why does sedentary behavior or physical inactivity, why is that increasing the risk of cancer? Essentially, there are a number of different pathways. We know that people who are more physically inactive or have more sedentary behavior tend to also have more problems with overweight and obesity, and those are very strong risk factors for cancer. We also know that there are problems with, for example, higher levels of insulin resistance and inflammation that come with being physically inactive. Also, some other hormones like sex hormones that are associated with the risk of developing breast cancer, those also seem to be increased when people are physically inactive. So there are a number of pathways that we've actually studied in some of the studies that I have done that have shown how those are related.
Someone's just asking about the difference in benefits of physical activity with the different types of cancers, and if the sample size in the studies played a role.
Yeah, so I mean, these studies were generally powered enough, but I mean, when we think about it, like, cancer is actually not one disease, right? So we have about 100 different kinds of cancers, and so it really depends on what the site of cancer is, whether physical activity can actually have an impact on that particular cancer site. So we're still very much trying to understand how physical activity influences the risk of developing cancer. And some of these pathways that I was talking about are important for some cancers, but not others. Some cancers are not associated with overweight. Some cancers are not associated with, different metabolic hormones or steroid hormones. So it's generally not a sample size issue. What is a problem sometimes, if we have cancers that are very rare, for example, let's say brain cancer, it's harder to do those studies because it's harder just to do a study with enough people to be able to have a large enough sample size to be able to do that. So you have to do studies over many years. I have done studies on breast cancer, prostate cancer, endometrial cancer, colon cancer, and for breast and colon cancer, the studies can be done quite quickly because we have enough people diagnosed with those cancers. But even with my study on endometrial cancer, it took us 5 years to recruit enough women in Alberta to be able to do the follow-up of them to have enough people to include in the case control study to look at how physical activity is related to their risk of developing cancer. And then we did a long-term follow-up that we just finished in 2019 because they had very good survival after cancer, so that we could see how physical activity done before and after their diagnosis was related to their survival. So these studies do take a long time, particularly if they're rarer cancers.
I guess that's a challenge. Someone's asking, and I feel like my mom's on the call, where do activities like sewing fall? So sewing, I guess if you're standing up, that's one question, but I can let you answer that, Christine.
Yeah. So any activity that's done sitting down would be called is a sedentary activity, right? So we have, like if you're, let's say, playing bridge or sitting at a table or reading or painting or anything like that where you're sitting down, that's a sedentary activity. So that, even though it's sometimes confusing because people will consider that a recreational activity when we talk about recreational activities, but that would be definitely sedentary.
I might get you to read the next one. I think I don't want to screw up some of the vernacular.
Someone said adenocarcinoma of the vulva.
Too wide local incisions.
Trying to see. Yeah. So this is always the issue, right? I mean, so what I didn't talk about is if you have specific symptoms that need to be controlled, it's important to work with somebody who's actually a trained exercise physiologist who has experience working with cancer survivors, because there are very specific issues that arise, like you mentioned here, with neuropathy and with side effects from the treatment. So it is, there are definitely all kinds of ways that exercise can be modified to help people who have specific issues, or there are certain kinds of exercise that can be done that wouldn't, impact those symptoms. And so it's very important to follow those guidelines. There was another roundtable that was organized by the American College of Sports Medicine that I didn't actually mention today, that was specifically coming up with what we call moving through cancer. These are exercise as medicine guidelines. And I believe you had a presentation by Kristen Campbell on those guidelines. So that's why I didn't spend much time on that. But essentially, and she and I were both involved in this roundtable where we looked at all of the evidence on how exercise can be used to help control symptoms after cancer, and where there's enough evidence to say exactly what type of activity, how often the activity should be done, like the dosing of the activity and the type of activities to help, relieve some of those symptoms. So I definitely think that this is something that everyone should consider, and that it's accessible. Even things like yoga, Tai Chi, that are very, have sort of a mindfulness component to it, have also been shown to be helpful. So hopefully you'll be able to find something that will work for you. And I'm happy to, follow up afterwards too with anybody.
Are you finding that through your research and the new guidelines that doctors are kind of on board, as we call it, and recommending exercise to their patients now when they're coming with diagnosis and treatment? And
yeah, I mean, I think it's definitely moved immensely since I started in this field in the 1990s, when, there was, like I said, quite a lot of hostility towards doing any kind of research with cancer patients and putting them on exercise protocols. I think there's so much overwhelming evidence now that it actually does help. And I think one of the turning points for us was we did a trial in breast cancer patients, who was the first ever trial where we put them on an exercise program during their chemotherapy. And when the results came through, we showed that the women who were on the aerobic exercise or resistance exercise arm of the trial were able to complete their treatments, their chemotherapy treatments, at a higher rate than those who just got usual care. And I think that was an aha moment for the oncologists, because they said, oh my gosh, these people are actually benefiting from doing exercise in addition to their regular treatments, and it helps them complete the treatments at a higher rate. It's a long process, though, to get oncologists to include exercise as part of standard care for cancer. And that's what we're working on, because we are really trying to still accumulate all the evidence about what's safe, what's feasible, what's efficacious. And so hopefully with time. But we have done presentations like, with some of the large oncology associations in Canada and the US and Europe and so on. And it's definitely coming out a lot more. And there's some great research that's happening in other places like Australia, where they actually came out in 2018 already with guidelines that basically said every cancer patient should be given an exercise program. So the Australians were way ahead of us, but I think it will get there.
Good. Yeah, sorry, I didn't mean to shush you. My daughter came into the room and I was like, no, shush, we're talking now. So sorry for that. One other question. So someone's asking about yoga and Tai Chi and if those are sedentary. So I can answer and Christine can elaborate. So you're moving when you're doing those activities. You're maybe not vigorously exercising, but they definitely are activity. They're not considered sedentary. So sedentary is, if I look at whoever I see on the screen right now, you're all sedentary, essentially. You're sitting there. So if you're moving around and doing that stuff, no, that's great. Yes, Jan, okay, I see you, you're moving. Christine, you can elaborate more if you want.
Yeah, no, absolutely. There are some of my colleagues have actually created like the Yoga Thrive program, which is specifically targeting cancer survivors. And there are also so-called mindfulness-based stress reduction programs that my colleagues in psychosocial oncology use. And they have done all kinds of research. It's a whole field called integrative oncology, where they're looking at Tai Chi, Qigong, all kinds of, meditative kind of movement combination activities. And yeah, they're definitely showing benefits.
not your traditional exercise, I guess, components when we think of that. So
Yeah.
I wanted to thank everybody for all your great questions and comments. Thank you again, Christine, for providing us with all this information. Next week, our talk is on a Wednesday, so pay attention to your days of the week, because I caught a member today and he was shocked it was today. So next week, Wednesday, April 7th, we have Dr. Bridget Saburin, surviving chronic pain for you and your loved ones. So that will be a really great talk. So hopefully you all join me next week, Wednesday. Huge thanks to all of you that came out. If you were in Winnipeg, you know we had a really crappy day of weather. It was just winter hit us out of nowhere. So hopefully spring is tomorrow. Hopefully Alberta, you guys had better weather than we did. I know it was kind of making its way through the country. It's always great to see all you guys. We love having you attend our Fit Talks and coming to the center to do your activity. So thank you, Christine, and thank you, everybody. It was great seeing you all.
Take care. Thanks, everyone. And thanks to you too. Bye-bye.